Welcome, ladies and gentlemen. We are about to start another live. This will be a very special live. I'm going to bring in Dr. Spinoso and Nurse Rachel Latner. We're going to talk about COVID 19. We're going to take some of your questions. We're going to ask them, what's happening in the medical field, what kind of precautions we can take during these times in order to prevent from getting sick, or just listen to their opinions. This live, you guys can ask questions. We're going to try to answer questions. Good afternoon, Dr. Spinoso. How are you?
How you doing? How you doing? Good to see you, Tarek.
So, I had so many messages the past 48 hours because, so many people want to hear from medical professionals, people who are actual doctors, who know other doctors, who are in the ER, who know what it takes to treat somebody. So I want to thank you for taking a little bit of time. I know you're extremely busy to help us out and give us some guidance.
Of course. Anything I can do.
So let's start with COVID-19. Tell me a little bit about COVID-19, what I should know from a doctor standpoint.
I think the main things we should know from obviously a doctor standpoint is that COVID-19 is real. I see a lot of things out there saying that it is a fake disease, a man-made disease, etc. No matter what it is a real thing. It is a real virus. It is a real disease, and it is spreading, and it has been spreading throughout the world. What people should know as well on the opposite side of that is that we deal with viruses all the time. Every 8 to 10 years, there is some mutation of some sort of virus that comes around and causes a lot of issues, a lot of deaths in the United States, things like that. So this is nothing new that people have not come up against before. The only difference between this and other viruses that we've come up against before is the argument is that there's no vaccine. However, this is a SARS type vaccine that's the same as, H1N1. It is a vaccine that changed itself and has mutated twice. So there's two types of SARS that is circulating around the world right now. But there is also a lot of good news that is starting to come out now that patients more and more have antibodies to this disease, meaning that they've already had it and it's already spread through large amounts of communities. LA, New York City, Miami, Florida, the Bay Area, a lot of places like that.
Thank you for that, Doctor. Doctor, my question to you is this. I've been looking at the numbers, and I'm a very numbers-oriented guy. I like to be, make statements based on numbers. The CDC presented an average death rate of 79 years of age. Our life expectancy in the United States is 78 years old. So based on those numbers, based on the numbers the CDC has provided, we can clearly assume that this is a virus that impacts seniors, a lot more seniors than younger people. Is that correct?
Yes, it will. Just like any virus, it will affect seniors more. That was one of the big reasons why Italy was so affected. Italy has an average population over the age of 65 years old, or 26% of the population is older than 65 years old.
So, okay, so that's why Italy was impacted so much. Now, talking about that, the numbers of deaths in New York have been dramatically higher than any other place. Just right here on the CDC, April 28th, 2020, the number of deaths in New York City is 9,961. So, if you compare that to, for instance, the state of California is 1,014. The state of Colorado is 482. Now, I know New York is a place where everybody travels, but it looks like there's a tremendous disparity and that New York has been impacted a lot more. How do you explain that?
Honestly, I think the biggest things that we see is that New York, like you said, is the melting pot. It's the epicenter. Besides LA, everybody goes through New York from that side of the world. Now, usually most viruses, most diseases travel around the world that way. They travel from Asian countries across Europe, then across the sea to the United States, the eastern seaboard, and then spread across the US towards California. So this is no different than what we see in a lot of other countries or in a lot of other diseases. The only difference that seemingly was here was because New York is such a tightly packed city, everybody's on top of each other. At the beginning of this, people were being sent home because they were just thinking it was an upper respiratory disease early on. So it spread a lot faster. Of course, if you're going to have a ton of people on top of each other, very close together, very tight knit, almost like Italy, where all the buildings are stacked up. You have multiple people passing in the hallways in their hotels, in their homes, etc. They're on top of each other. It's very easy to spread disease that way.
No, one of the things that it's interesting to me, I was in Asia in March, and I was at New Delhi airport, highly concentrated, a lot closer to Wuhan, China, than United States. For that matter, Shanghai, Beijing, cities in China have not been impacted as much as New York. Why is the United States suffering a lot more than some of these other countries that don't have the technology that we have? We're supposed to have the best health system in the world, right? What is going on?
Actually, we don't have the best health system in the world. We're number 37 in the world for health systems. In terms of health systems, we are still a very business-oriented health system, and with that, we have a lot of pitfalls. And I know there's that new article that came out with the CDC actually reimbursing much higher for treating a COVID patient or treating a patient on a ventilator. And that's how treatments kind of have always been in the United States. The more severe the disease, the better the reimbursement. And I think the problem is that they shut down a lot of the other parts of the hospital systems here in New York City. So it automatically created a numbers problem with the amount of healthcare providers that were there. You had to fly in healthcare providers, plus the number of people that were just afraid. There was just a severe fear at the beginning of this because, unfortunately, I think the media really failed us on this. And they said everybody was going to die. They said millions and millions of people will die right away, no matter what. There was no stopping it. So there was a lot of fear. Everybody, of course, with a little bit of cough or anything like that is going to run to the ER and is just going to make it overwhelming.
Now, and I pardon my ignorance. I don't have any experience in the medical field, so maybe my questions are not adequate to your knowledge and your time.
No, this is perfect.
There are rumors that once, based on my knowledge, which is limited, again, if you get a virus, your body creates, a resistance, an automatic resistance, and then you are somehow protected from this virus. So once you have this virus, your chances of capturing this virus again are zero, correct?
No, they are lower, but they're not zero. And the interesting thing is that people are waiting for a vaccine that probably won't be developed for another 18 to 24 months. And the issues with vaccines are the same as the issues with a body producing antibodies. So when a person gets sick, they produce antibodies. It's a memory for their body to fight off that disease should it come back again. The problem with that is that it does not just completely immunize you. You don't have to worry about ever getting it again. The problem is that you can still get it again. It's just much more difficult, and your body has already fought it off, so it knows what it's doing the next time you get sick. So it's great that all these people have antibodies because a lot of them didn't even know that they were sick. Their body already created antibodies, kicked the virus out, and passed it along, which is how viruses work and how herd immunity works. So even if you use a vaccination, you could still get sick. That's the problem, is that everybody is waiting for this golden vaccination. We have governors saying, in California, we're going to be shut down until there's a vaccination. That doesn't guarantee anything in the end of this. But the good news on the other side of that is that there's so many people that have developed antibodies and fought this disease off that the numbers are starting to grow of people who were infected. And it shows that the mortality rate is actually much lower than it was originally thought to be.
Now, I know it's a hard thing to predict, but some people, the pessimists, they say, the mortality rate is 5%. Some
Mm-hmm.
people, they say the mortality rate is 1%. The CDC right now, I'm looking at the CDC, and they're doing something that's quite interesting. They go place of death, and then they go COVID-19 deaths, 31,587. And then right after, they have pneumonia deaths, 6,340. And then they have something called deaths with pneumonia and COVID-19, 14,124. So can you explain to me, and what is the reason? They're even actually mentioning influenza deaths, 5,748. If you have COVID-19, eventually you get pneumonia and you die. Is that a combination of things?
Yes. So COVID-19 is a virus that attacks the lungs. When you attack the lungs, you're going to have what seems to be a buildup of inflammatory markers in the lungs. There seems to be what's called the cytokine storm, where the body tries to fight it off, but then kind of freaks out, and you get phlegm buildup and inflammation in the lungs. That phlegm buildup and inflammation in the lungs is pneumonia. And a lot of times that's why these patients need to be intubated. These patients need to be what's called prone, so put on their bellies so their lungs expand a little bit easier. And it's very difficult at that point to tell whether a person succumbed to a heart attack or lung issues or COVID-19. But the thing is, all of these are being counted as COVID-19 on the death certificates. So it's very difficult.
So everybody that has COVID-19, eventually, if it aggravates, they're seniors. If it aggravates, they get pneumonia. Is that correct?
They can. Not everybody, but yes, it is one of the things with COVID-19, an infection in the lungs, pneumonia based.
So I'm looking at the CDC here, and it says COVID-19 deaths, 31,587. Pneumonia deaths, 6,340. But then they have deaths with pneumonia and COVID-19, 14,000. What's the discrepancy here? Are more people dying of pneumonia that's not related with COVID-19 than the actual COVID-19?
Yeah, so that's just what it is it's kind of just a play on words. So you have COVID deaths. People, not everybody that gets COVID is going to get pneumonia. They may pass away from other things. They may pass away from heart issues. A lot of times, we're counting patients now that have had terminal cancer, brain aneurysms, motor vehicle accidents. If they test positive for COVID-19, it's being put on their death certificate as contributing to the COVID-19 death count.
So I could be coughing right now. I'm 41 years old. I'm fairly healthy. I could be coughing right now. I die in a car accident and I go to the hospital, and obviously I died because of trauma. But once they check my blood and they see that I had COVID-19, they're going to put on my death certificate that I died because of COVID-19?
Yes, that's what's going on right now.
Well, that obviously inflates the numbers. And there was actually doctors, Dr. Erickson, Dr. Masihi, they just had a video on YouTube. Elon Musk from Tesla reposted 5.46 million views, and YouTube took it down. And those were physicians. They were not presenting any type of, sensationalism. Those were physicians. Did you get a chance to watch that video?
Yeah, I did watch that video.
So can you comment? Those are very respectable, reputable doctors in Bakersfield. They actually testing for COVID-19. Talk to us about this video. Is it 100% credible, legitimate?
Yeah, I think what they did is they presented it in a way where they agreed with the shutdown at the beginning. We didn't know what was going to happen. We didn't know if it was going to kill 1 million people. So I agree with that point. And what they were trying to argue at the end of it was, hey, at this point, the death rate, because of the amount of patients that we've found with antibodies in their system, and that it doesn't seem to be as deadly as the news is saying it is and things like that, that it should be safe to open up in a stage-wise pattern. We shouldn't be waiting until this disease completely goes away, because the problem is that if we wait till it completely goes away, it will never completely goes away. Staying at home was a good idea at the beginning. We flattened the curve, but I've seen the argument that as soon as everybody comes back out to do what they want to do, it's going to explode again. Well, that's what happens with any types of virus. It's going to ebb and flow. People are going to pass it around. I think the main issue with theirs was that they were extrapolating the data just in one group of people and saying that it is indicative of everybody in the country. They should have said it was just indicative of everybody in their county, because they tested 5,000 people, which is a significant number in a county. And I completely agree. They came up with great ideas. The problem is that people are angry that YouTube took it down, and I know the CEO of YouTube has announced publicly that anything that goes against the WHO, the World Health Organization standards and recommendations, they are going to take down completely. So things like Facebook, things like, even Instagram, things like YouTube are being censored right now because these are privately owned platforms a lot of times. So they're allowed to say whatever they want and change the narrative to whatever they feel like is necessary on there. And it's kind of disheartening, because you get different physicians and providers like these two doctors who came with a very logical explanation. Could have been a good debate, but unfortunately, in the statistical world, it's being picked apart piece by piece by piece. But we don't have any answers right now. Nobody has a good answer for this. It's either, if you want to open up, you are a money-hungry human killer. And if you want to stay home forever, you're a moron couch potato. There hasn't been any type of conversation that, hey, this is getting ridiculous. We are crushing our own economy. We're crushing businesses. We're crushing hospitals right now. Hospitals are laying off people. They are declaring bankruptcy. Large hospital systems that have 20, 25 hospitals in them are closing completely for good. Gyms, the gyms, closing for good. These are companies that will not be able to open back up because we're continuing to just sit at home and not have a proactive plan to get things moving.
And doctor, I'd like for you to go a little bit deeper on that, because just today I read on the news, I sent it to my brother, Palomar Clinics, they closed 7 locations. Those are actual clinics that help people. I have 2 children. My children are not allowed to go and get vaccinated. They're not allowed to get vaccinated because of COVID-19. So I have 2 small children that do not have the ability to protect themselves against other diseases because of COVID-19. Now, in the medical field, people are hurting. We see doctors losing, hospitals losing money, doctors losing their job. The hours are being cut short. So a lot of people say, well, if you get sick, you're going to go to the hospital and put a lot of pressure on the doctors. Well, the doctors are getting laid off as it is right now. Talk to me about what's happening in the medical field. Not only COVID-19, but actually losing business, losing money, losing customers. My children are not getting vaccinated. What's happening in the medical field?
Yeah, what we're seeing is a large amount of these hospital systems, almost every hospital system, they rely on patients being there for a longer period of time, a few days after surgeries. They rely on sick people being there for a week to make sure that they're fully recovered before they're sent out to any type of rehab facility. And they rely heavily on same-day surgeries, elective surgeries. All those things were completely shut down with COVID-19, including primary care, like you're talking about, including OB. So you have patients that have suspected COVID-19 completely alone in the hospital, no visitors. They're being told what to do by their doctors. Then on the other side of the things, we have completely empty floors that would normally be filled, where these hospitals can actually afford to pay their doctors, pay their nurses, pay their physical therapists, pay the sanitation crews. And they're laying all those people off. They're furloughing them. And the problem is that the nurses and doctors that still have jobs in the hospital, they're getting their salaries cut. Stanford just released, I think it was a week ago, that the nurses that are still there are getting a 20% cut in salary and pay, because the hospitals can't afford to stay open. They can't afford to pay anybody. The clinics that you're talking about, the urgent care clinics, the primary care clinics, all those quote unquote non-essential businesses, they're being closed. I mean, I have a good friend. She's got stage 3 cancer. She was supposed to have chemo radiation after a mastectomy. They canceled her chemo and radiation for cancer patients. You have brain aneurysm patients. There was something ridiculous. I have to go back and read the actual number. Something like 88% of brain surgeries were canceled.
Wow.
Because of this. I mean, imagine the amount of deaths that are just going to come from those two things: waiting on cancer, brain surgeries. I mean, and then you spread it to the other things where if there is a second wave, when people start to go out and there's a little bump in the healthcare system, we're short-staffed now. Hospital systems are short-staffed. Urgent cares are closing. Minute clinics are closing. You can't treat people with even less numbers than we did before. So that's the concerning thing, is that now the New York Times came out with an article today that there's 40,000 more deaths that are unaccounted for around the world. It's kind of a scare article, I think. 40,000 more deaths. Every country around the world has more deaths this year. And they said, it was a single sentence in the article that says that some of the people that they counted were likely due to the fact that elective surgeries and life-saving treatments were canceled due to COVID-19. So they're attributing these deaths to COVID-19. However, these are patients that had cancer, brain aneurysms, things that the medical field could have helped them and could have saved them, but they unfortunately are going to have irreparable damage or death because they couldn't get the treatment that they needed.
You know, that's shocking. And, you know, I could not reason when my wife came back. We have Kaiser Permanente right here in Murrieta. When my wife came back and she told me, our children will not get vaccinated. You pay for your health insurance, you pay for your taxes, but your children will not be vaccinated because of COVID-19. So if COVID-19 stays on for 2-3 years, my children will not be vaccinated. And now all these deaths happening because we're laying off doctors. Now, my question to you is this. Germany apparently, based on the numbers, and I know that right now a lot of these numbers are speculation, but it looked like Germany had similar cases at one point of Spain, but the death rate was a lot lower.
Mm-hmm.
And I think I heard something about they were a little bit more proactive and faster with the testing. Can you please elaborate on that, doctor?
Well, I think at the beginning that the testing that we were talking about, the testing we had here, it was delayed. There was a lot of issues with delayed testing. There was a lot of issues. There's a lot of red tape in the United States. A lot of red tape in the United States when it comes to anything. When it comes to treatment of a disease, when it comes to trying to try new medicines, as you saw with this hydroxychloroquine and azithromycin, people having trouble getting it, and being in the studies, even pushing it through studies. Treatments such as stem cell treatments, you've seen plasma treatments, all these different treatments. It's very, very difficult to get any of these things pushed through. And we unfortunately failed because I think a large part the World Health Organization weren't giving us true numbers. They weren't giving us things that we could properly put into place, saying, okay, there's going to be this many deaths. We need to prepare in this way. We need this many ventilators. Kind of like, this is going to be the tipping point. We need to figure out where we're going to treat these patients. And there are a lot of countries, Germany, I mean, I think Spain, let's see, Spain, France, some of them moved a lot faster on this disease than we did because we just weren't, we were just kind of sitting back waiting to see what was going on. But I think a lot of people wishes that they had closed the country down earlier. And I would argue almost against that because we're now seeing antibodies from patients who got sick in December and January. Now, this suggests that this disease was around December, January, and then February was when we first started to diagnose this COVID-19. So it doesn't seem like, how did the death rate go from December, January, February, it's not okay, and then March, April, all of a sudden everybody's going to die of this disease. If you go outside, you will die. If you don't wear a mask, you will die. I don't get that in these numbers because it doesn't make sense. It doesn't make sense that all of a sudden the virility of a disease spikes. It doesn't.
Mm-hmm. Yeah, it's do you think that one of the biggest issues has been censorship on one side and misinformation on the other, right? So you have right now these two doctors, Dr. Erickson, Dr. Masihi. They post a video, 5.46 million views. Elon Musk reposted. You said it's a really good video, and now we are censoring these doctors. So that's preventing us from having a debate. But at the same time, you go on Facebook and there's all types of jokes about how you can treat COVID-19. But they had the guts to censor two doctors, but they don't have the guts to censor all this nonsense that's happening on social media. Do you think misinformation has also impacted our government's decision making?
100% yes. I will 100% agree with that. I think the way to control any type of people and to get them to do what you want is fear. And I think the way to completely dispel fear is education. And the problem is that we have not done a very good job at all of educating people as to the disease, as to why the stay-at-home order is important in certain risky people, as to why they haven't explained at all why the stay-at-home order is necessary in young, healthy people who have antibodies and seem to not have issues with the disease and fought it off. There's no education on that. It's just, hey, young, healthy people are getting it. You will die. And then they post up a picture of an overweight person that died from the disease. Well, the study in New York City showed that 46% of people who died were obese. 19% of those people morbidly obese. So it was 98% of the people that have passed away so far had one or more comorbidity. Obesity, hypertension, diabetes, something else other than that. That isn't being educated out there. The narrative is young people are dying. You shouldn't go out there. I mean, kids can get it. Your kids are unsafe. Everybody needs to cover themselves with a mask. Wait, no, don't wear masks. Wrap a towel around your head or a bandana. Wait, no, don't do that because the healthcare workers are wrapping bandanas around their head from the CDC. That was an article of the CDC. Wrap a bandana if you're a healthcare worker and you're out of masks. I mean, it's the misinformation and the back and forth has just really clouded everybody's idea of this. And the best way to control a large amount of people is just to confuse the shit out of them.
Yeah. Talking about, here are the CDC numbers for the number of deaths involving coronavirus disease. If you're a child 1 to 4, right? My daughter 1 to 4, 2 people have died, 2 kids. 5 to 14, which is a tremendous 41 million people. 41 million people, 2 people have died. 15 to 24, 42 million people, 33 people have died. 25 to 34, 45 million people, 242 people have died. My age, my brother's age, 35 to 44, 41,000 people, 599. Let's see where we have the most deaths. 85 years old or older, 6 million people, 6.544, 9,638. This is clearly a disease that impacts seniors. Now, before I let you go, I know you're very busy, doctor. I want you to tell all of us. I'm a gym goer. I believe that if you exercise, you're healthier. When I exercise, I become healthier. I feel like my breathing is better. When I do cardio, I feel like the hormone, the serotonin, my breathing is better. I feel better during the day. I'm 41 years old. If people were working out under the age of 50, they were all in the gym working out. If the message from the government was, if you're a senior, stay home. If you are under the age of 40, get to the gym, start exercising, wear a mask, but get your immune system better. Would that be a crazy advice?
No, I don't think that'd be a crazy advice at all. I advise my patients to do that. I mean, number one, to boost your immune system is good sleep, good sex, and exercise, period. And those last two things can be the same thing. When you exercise, you're going to boost your immune system. Breathing fresh air, getting sunlight, obviously not the sunlight that kills coronavirus like all these people are talking about out there, but getting sunlight, vitamin D, boosting vitamin C's, exercising, those are all going to significantly boost your immune system, significantly boost your ability to fight off any type of virus, significantly boost your health in general, your mental state, etc. All of it. No, that is not crazy at all of a situation. And if you actually look at the patients who were exercising or were healthy before and had some sort of good diet, their mortality rate is essentially zero, because their immune system was prepared for this. They were out, they were exercising, they were being healthy. And that is the biggest problem that I've seen here, is that they've shut down gyms, they've stopped people from exercising, they shut down like supplement stores, but places like McDonald's and Burger King and all these fast food places where you can drive through and get the food, that's essential. There's no reason why we shouldn't have an essential health food store where patients can drive through and get their groceries from. They're doing it in Walmart.
Yeah. Well, doctor, very enlightening. I knew this. So many people send me messages. They were waiting to hear from you. I want to thank you so much. I've been a fan of yours for, a long time. I've been following you. I had a chance to watch you on stage, your wife on stage. You guys were amazing competitors. And then when I discovered your profession through Facebook and Instagram, I follow you and I try to learn as much as possible from you. I really want to thank you for your time, doctor. You're a true hero. And, I'm honored to have you here.
Yeah, I'm honored to be on. Thank you to you and to Tamer and to the entire Muscle Contest crew. And hopefully this thing will be over soon so we can have USAs and everything back out here. So I'm pumped.
Sounds good. Thank you so much, Dr. Spinoso.
Have a good one.
You too.
Bye.
So just